Every year, the international community celebrates World Malaria Day to take stock of the achievements in malaria control and to re-examine and reorientate the vision in order to ensure better results. Malaria, which remains a socio-economic and health burden, exists in all parts of Cameroon. As being a country with enormous disparities in the climatic conditions as well as ecological build-up, there are bound to be significant differences in the situation of malaria morbidity. In 2016, the prevalence of malaria varied between 13.6% in the northwest region and 29.3% in the north region. According to official statistics, close to 2 million cases are received annually in hospitals. This falls below the estimated expected number of 5 million confirmed cases, showing a positive evolution in the fight against malaria, for there is equally a drop in the mortality rate.
We are talking about 21% of drop in new cases, and we are talking about 31% of drop in deaths related to malaria. So the global fight against the disease is going on.
In 2016, mortality varied between 3.6% in the northwest region and 27.3% in the north region. Although there are signs of some improvement, much is yet to be done because these figures are those registered in the health centers, and about 4,000 deaths are recorded annually due to malaria since 2014. Of this figure, 70% occur among children aged below 5 years. With this year's theme, which is End Malaria for Good, there is an urgent call for everyone to be determined to get rid of malaria definitely. Experts say this can be positive if we make use of tools available for the fight against this disease.
Impregnated mosquito nets, which are used with good results. We think that those tools should be emphasized, and they should be used and produced more locally, because if we have such a problem and we have identified the way to fight against it, it's normal that we emphasize and we multiply the number of products to fight against the disease.
With the National Strategic Plan to reduce the number of malaria cases and deaths by 75% by 2018, sensitization on preventive and curative services have been made available to the population so that no one could claim ignorance about malaria.
Knowing the disease is better if you want to get rid of malaria, knowing the vector, which is a mosquito. If we know how they breed, if we know how they bite, we know the habits of the mosquito, we can think of eradicating the disease.
Much resources have been mobilized by the state and its partners in order to attain this objective, because we can be the generation to end malaria for good.